Hi there, in this video I'm going to go over one cause, a fairly common cause of back pain. So imagine, if you will, a patient coming to the chiropractor complaining of pain in the low back. The patient may be male or female, probably middle-aged or older, and the pain is reasonably diffuse, perhaps slightly hard for the patient to really indicate just where the pain is. But when the chiropractor examines the patients, they find that there's some muscle spasm in the back, that the sacroiliac joint on one side perhaps is quite tender to touch. And when they examine the patient's flank, which is where one of the kidneys is, then they find that that's tender too. So the chiropractor will then do a urine test. And interestingly, in this patient, what we'll see is that the patch on the urine dipstick that shows us whether there is any sugar in the urine shows us that there is. So the suggestion is that the patient may well be diabetic. Furthermore, the square that indicates whether there's protein in the urine shows that there is protein in the urine, which there really shouldn't be, and that suggests that the filtration process that should be happening in the kidney really isn't working as well as it should be, because the patient may have diabetic nephropathy, which is where the kidneys tend to deteriorate with the diabetes, and this causes all sorts of problems, including kicking off problems in the back. So can we help this patient? Well, we can possibly help some of the symptoms. We don't want to be giving lots of painkillers to people with kidney disease, so physical treatments, if they work, make lots of sense. So massage to tight muscles, stretching techniques, manipulations to tender sacroiliac joints. But of course the patient's going to need some medical input as well. So they may well need medication to sort out their sugar handling. The blood pressure often needs to be reduced, and the sort of kidney function needs to be sorted out. So they will need a trip to their GP. They'll need to change their lifestyle as well. These patients often are sedentary and not doing enough exercise. And increasing exercise will help them. They'll need to lose weight, and they'll need to change their diet. And there is quite a lot of exciting work being done about low-carb diets. There's an article produced by Dr. David Unwin in diabetes.co.uk recently, where he's suggesting that diabetes, or the effects of diabetes, may be reversible with low-carb diets. So if you're diabetic, or you know someone who is diabetic, that's really worth checking out. I encourage you to do that. Do you know what's causing your back pain? If you don't, then give us a ring. It's our job to find out what's causing your back pain and to help you get well. My name's Andrew Rowe, and my colleague Tara Craig and I work at Abingdon Chiropractic Clinic. This is our website address and our phone number, so get in touch and make an appointment if you want to know what's causing your back pain. Thanks for watching.